Our next session in the leadership stream is developing consistent water management plans and programs for diverse portfolios. So our presenter today is Chris Boyd, and Chris is a senior consultant with Mark Strategic Solutions, a public health, safety, and security consultancy. Prior to that, he was NYC Health Assistant Commissioner of Environmental Sciences and Engineering, where he was responsible for regulatory oversight of the NYC drinking water supply, recreational water, radiological risk management, environmental outbreak investigations, and the first proactive regulatory framework for cooling tower systems in North America. In 2019, he facilitated discussions with 20 public agencies across North America to create consistent electronic cooling tower registration and inspection systems. He now supports global NGOs, U.S. national labs, public agencies, and private sector stakeholders to develop systemic strategies to improve the management of public health and security risks. So please welcome Chris.
Greetings. Thank you so much for that kind introduction, and I am sorry that I can't be with you in person. Folks who've worked with me know that I am a Canadian file, and I spend as much time in beautiful Canada as I possibly can, in particular with some very good colleagues with the city of Vancouver, who create the opportunity for this important talk about how we approach the management of risk from building water systems. This talk also dovetails really nicely with the previous presentation, where we talk about what are the regulatory frameworks and the responsibilities, both liability and criminal risks for building owners as we reframe how these building water systems are addressed. And that really is part of the bottom line for this talk, that building water systems are life and safety systems, and building owners must create water management plans and programs that prevent illness and death. And we'll talk a little bit about what those disease trends look like and why the regulatory frameworks are ramping up. One of the things I like to highlight for folks in the drinking water and wastewater industry, and the majority of the people at this particular conference are in the wastewater and drinking water industry, think back at your institution and identify one person that your institution has killed. Think back across the history of your organization. How many times does your organization kill someone? And the answer is generally no. That we run these systems to be safe. We run these systems to be consistently delivering safe water and protecting the environment. And we've got standards of care that we employ in very complex scenarios. And when we do have failures, as an industry, we robustly respond to those failures. The Wahkiton Center of Excellence is an example of that. We need to move and reframe building water systems within buildings into a similar framework. So the building systems of risk are plentiful, but there are a few that are more likely to be associated with illness and disease and opportunistic pathogens. So we've got plumbing, cooling towers, decorative fountains, on-site water storage, pools and spas, ice machines. If not properly maintained, can be sources of disease. And when we look at the disease trends, they're pretty stark. So the building water system disease burden is rapidly increasing, and it is significantly underreported. So these trend lines of reported cases of disease are significantly underreporting the incidence rate. Often, if it's not an acute illness that requires hospitalization, Legionella cases often go undiagnosed. We don't have a systemic approach to sampling folks who manifest at a healthcare institution with pneumonia to say, I wonder if this is community-acquired pneumonia from Legionella. So when we look at the disease estimates, the National Academies of Sciences, Engineering, and Medicine estimated that in the United States, the true disease burden from Legionella is between 52,000 and 70,000 cases a year. 70,000 cases of illness associated with the building water system in the United States. And the estimate of the true disease burden is 10 times greater than what we get reported through the National Disease Reporting System. So what's happening in these building water systems that are driving these negative public health outcomes? And Legionella is a naturally occurring organism in the environment. In its natural environment, it poses little to no public health risk. It only becomes a public health concern when it enters an engineered water system that creates artificial conditions that allow it to amplify in a manner that it doesn't in the natural environment, embedding inside biofilms within those engineered systems. And then it requires a second step. So you need to have a system that is promoting an unnatural condition that allows it to amplify. And then we need a second step, and that second step is an exposure pathway. So you need to aerosolize that Legionella into a mist. Those droplets are inhaled and enter the lungs, and then those lungs become the new habitat for that Legionella to grow and cause illness and often death. So we need those conditions to be present to have the public health risk. And what we're seeing is that our building water systems are being managed in ways that are not controlling that amplification and not reducing the opportunity for exposure, and we see disease. This is true for Canada as well. So when we look at the case rates in Canada, we see a national rise. This particular chart's broken out by Ontario, BC, and national rates. And we also know that we've got a number of really significant outbreaks in Canada, more than in the United States, actually, in terms of their size. So we had a very large outbreak in 2005 in Toronto, 135 cases and 23 deaths. We had a significant outbreak in Quebec, 181 cases and 14 deaths. We had an outbreak in 2018 in Surrey, which is in BC, 14 cases and 2 deaths. We've had 2 repeated outbreaks in 2019 and 2021 in Moncton. We've had a number of papers looking at disease trends in the Toronto area and identifying outbreaks that were not identified by public health agencies, but deploying statistical models for the pacing of those cases. So we see both rising cases overall, and we've got kind of horrible case study examples of significant outbreaks with resulting in disease and death within Canada. Despite those really clear outcomes, lots of disease and examples of death and identified systems that are causing that disease, we haven't seen a robust regulatory response across Canada. Now, if we think back as water utility folks, if I listed a whole series of water treatment plants that had operational failures that created that kind of acute illness and death, we as an industry would have a fit. We would have a complete meltdown, right, at our failure to properly manage those systems so they don't have those outcomes. And we would have a national reckoning, right? We have a center of excellence that was built around one example of a failure to properly manage E. coli. But we don't have a similar response when we have building water systems that cause even more disease and death than those examples. So I think that's a really interesting thing for the water utility folks to kind of think about. Why are these water systems thought about so differently than the others? And so what we do know is that the majority of disease is preventable. So the Center for Disease Control in the United States did a case study review. They found that 9 in 10 outbreak cases could have been prevented with a properly implemented water management plan, designed and implemented. We also know that the Legionella cases in healthcare settings have the greatest negative outcomes. In general, 10% of people who get Legionnaire's disease will die. In a healthcare setting, that number goes up to 25%. So the rate of people dying once they get the disease is quite high in general. In healthcare, it's particularly high. So what we need to do, right, is change the expectations of behavior for building owners, their staff, and the vendors that support those buildings. So in order to do that, we need to create prescriptive performance-based standards. That is key to reducing illness, injury, and death from these building water systems. So creating expectations of behavior and then creating the systems to help people successfully manage those risks. Now, how are we approaching the regulatory frameworks around building water systems? So we've got federal expectations, provincial and city expectations, and then we got owner expectations. So at the federal level, we've got drinking water expectations for the quality of the water. Those regulations generally end at the connection to the building. We have health agencies that put out guidance, encouraging people to do good behavior. And we've got federal agencies that work with healthcare institutions to have them manage infection disease prevention. And then at the provincial and city level, that's where we're actually seeing proactive strategies to direct building owners to manage risk, right? Outside of a few cities, Quebec, Hamilton, and Vancouver, within Canada, there's no expectation for the management of risk from building water systems and them causing illness and disease. So the cities are taking on this responsibility. The provincial governments are taking on this responsibility. The federal government has largely been silent beyond saying, we hope people behave in ways that don't make people sick. And then we get the building owners. And so they're responding to regulatory requirements. They want to meet or exceed their internal duty of care expectations. And they want to facilitate the safe use of the water in their buildings. So as we've seen increasing rates of disease and a range of different kinds of regulatory strategies, what I argue is that we need both of these things in place in order to be successful in managing risk. So we need the public sector to develop some expectations of behavior and to have some way to evaluate whether or not risk is being managed. But we also need building owners to take on the responsibility of their duty of care to create their expectations internally for everyone who interacts with the water systems that they control. So on the public sector side, we see Vancouver, Quebec, Hamilton. The Canadian federal government has a very successful water safety protocol for its federal buildings. We've seen regulatory strategies in New York and New York State. The in the U.S., the Center for Medicaid and Medicare Services has created expectations for risk management for all healthcare institutions that receive federal funding. And the U.S. Federal Affairs Administration has also developed a robust approach to managing risk and requiring water safety and water management plans. On the private sector side, what we see is large global companies developing standardized approaches for the management of risk from their water systems. Nestle is an example, Hilton Hotels is an example, Marriott Hotels is an example, Heineken is an example of global companies that have created internal water safety guidance and standards of behavior, standard operating procedures for how systems are managed, and then are trying now to drive that across their diverse portfolios. Now, within Vancouver, we've got some really interesting things that are happening. One, for folks who don't realize it, you've got to have an operating permit for a number of higher risk systems. You need to have a certified operator, someone who is has a professional certification to oversee the management of these complex higher risk systems. This is critically important to the professionalization of the oversight of these systems and changing that framework from kind of a wild, wild west, which it is right now, to one where we have an expectation that the folks who are interacting with these higher risk systems have a certain skill set. They understand how to manage those systems. They're operating to professional and ethical standards for those systems. They don't let them operate in ways that cause risk. You know, I can tell you right now, across Vancouver, we've got systems that are in high need of intervention because they're not being managed well. Once we change the professional expectations, those systems are going to start to be managed better because there's going to be professional and ethical expectations of the people who are interacting with those systems, similar to the professional and ethical expectations of wastewater plant operators and drinking water plant operators. So that's a really important, it's actually the first example in North America for making that change. It was something I was really, really supportive of and working with Vancouver on their regulatory framework. And then also you've got to perform Legionella sampling starting in January for all your cooling towers. You have to perform corrective action. You have to maintain detailed records for 24 months. Lots of new expectations of behavior for building owners and the vendors that come in. So when you've got this big change in regulatory frameworks and expectations, there's a learning curve, both for building owners and for all the vendors and support services that are working with those building water systems. So when we look at the panoply of people who are interacting with building water systems, we got water treatment firms, water consulting firms, environmental consultants, professional engineers, laboratory companies, internal staff. All of these folks are interacting with these systems, very often interacting independently with no communication, with no standardized approach for record keeping, all of those things that are important from your investigation and inspection point of view if you are in a building that's associated with disease. So what happens now is that all of that information flows to the building owner in idiosyncratic ways. And the building owner is expecting good behavior from those vendors, but isn't organizing their activity generally. Now that we've got a regulatory framework in place, now all of those activities from all those different vendors are being interpreted through a regulatory framework. What the building owner then has to do is then build a corporate procedure for how they expect those vendors to behave in their building so that the behavior doesn't change when you swap out vendors, right? The building owner needs to own their duty of care for those systems. And once we've got this arrangement happening, now we've got shared knowledge flowing from the building owner about what their corporate protocols are to their vendors, and they're aligning that protocol to the regulatory framework. This is a sea change in how these systems are normally managed in North America. So right now, we're at a point where we've got high liability, lots of inconsistency in the management of risk. So generally, we got limited team knowledge, poor communication, rudimentary or no planning for safety. All the activity is oriented towards asset management, not health and safety. So how do we move to a better outcome? So we have to build organizational capacity. The building owner and the building owner team, which can be supported by external resources, of course, folks with expertise in this area, they build their internal organizational capacity. They develop their internal procedures and protocols. They create a water management team that often includes third-party vendors who are servicing those pieces of equipment and making sure that those people are behaving in alignment with the corporate policies and procedures. And then that water management team identifies the systems that need to be managed, defines what that looks like, assigns roles and responsibilities, and then manages the records associated with the activity, right? Think back to that slide for Vancouver. Detailed maintenance records for 24 months need to be maintained. How are you going to do that? With 4 different vendors, on-site staff, you need to have a plan and a strategy for that. And once you put that in place, now we're in a low-risk environment. We got regulatory compliance, and we're driving our desired outcomes. Now, we can't eliminate all risk, right? That's part of our duty of care responsibility to do our darndest to prevent it. But if something does happen, now we've got a record to demonstrate to the inspector, to the investigator, to the enforcement agencies that we acted within an appropriate duty of care for our building and did it thoughtfully and carefully and responded to corrective actions as they were identified. So we have high understanding and knowledge, formalized communication between the different team members. We've got planned control measures based on identified risks, right? And then we've got consistent record keeping. So when we talk about a water management plan, it's really important that we always put that second word in there, program. It's a water management plan and program. The water management plan is the roadmap, right? Specific to your organization for how you approach the management of risk and getting your systems to be safe. The water management program is how that plan is implemented. Simply having a book, right, doesn't translate into an implemented plan. Both of those things have to be together and thought through. So we've got really good guidance documents out there for how to organize and think about structuring a plan, right? What's critical is that building owners use these guidance documents, work with folks who understand them, and develop their internal procedures that align to these approaches. Simply having a cut and paste plan is not a water management plan and program. It needs to be specific to your organization. It needs to be specific to the buildings you work with. So we generally have about 9 steps in the mix. Establish a water management team, understand your water systems, do a hazard analysis, identify where you're going to control risk, identify what measures you're going to use, determine the control limits that tell you whether or not you're within the ranges of tolerance that you find acceptable. How are you monitoring that water quality to evaluate whether or not your plan is being done effectively? Your corrective actions for when you fall out of those ranges of acceptable water quality, And how do you verify and validate that, right? All those plans I just showed you generally structure down to these 9 broad categories. So those 9 broad categories need to be defined for your institution and for your corporate policy in a very specific way. And you want to capture that information consistently from site A to site B to site C. So that information is rolled up consistently across the portfolio, and everyone, whether or not they switch from site A to site B, is interacting with a water management plan that has a similar structure, scope, and expectations of behavior. So you want to define the routine monitoring measurements and where they are. You want to know what those corrective actions look like. You're going to validate how that work is done and is it being effective. And those are where your duty of care decisions are as a building owner, as a portfolio manager, as an institution. This is where you decide, how do we want to approach the management of risk for these systems across our firm, our institution? And so now let's think about what are some of the best practices for how do we integrate all this? It can feel like this might be overwhelming, right? So we're creating an internal standardized protocol. We're applying that protocol to multiple locations. We've got a dozen vendors that we're interacting with across our large portfolio and our institution. How do we integrate all of this activity and behavior? How do we drive consistency in the organization of the water management plan and its implementation, and effectively implement that program? So here's an example of what I think of as a real best practice, right? And so this is developed by an IT firm out of Toronto called Groveware, and I'll walk through a few of the strategies that they've used with really large global firms to help them standardize the implementation of water management plans and track their implementation across a range of role holders. So what you want your plan to do is integrate all the key activities that are implementing that water management plan across the different user roles, right? So you're going to have internal staff, you're going to have regional staff, you're going to have base building staff, you're going to have vendors, you're going to have a range of consultants, all these people who are interacting with these systems. You need to integrate both what their expectations are, right? How do you organize what you tell them to do? And then how do you know that they're doing the things that you've asked them to do? So part of that is standardizing inputs, right? And so these are, this particular approach is a mobile platform that works on computers and phones and tablets. And so you collect the information in a standardized way. So this is an example of, how do you organize the team members, right? You're getting first, last name, email, phone, title, and then deeper in, you're going to grab some roles and responsibilities. How do they fit in with specific water systems within that building and within your portfolio? The other thing is knowing what systems exist where, right? Where is your internal what's your internal strategy for knowing where all these different kinds of water systems that have risk are? And so one of the things to do is to say, okay, let's define out all of our high-risk systems and then begin to frame out what are our expectations for management of those types of systems. And so each building goes through its own survey, identifies all the different systems that exist, and they all get assigned an ID. They all get assigned a person who's responsible for them. But now you're doing it consistently across your institution in every building. And so now you see all of it in real time. And so you start to see how your water management plan starts to become site-specific, right? And then you've got standard operational procedures. This is an example for cooling towers. What is happening? How do you do it? How do you set those frameworks? And so as you're doing these assessments of the system, you start to assign roles and responsibilities, frequencies of activity. So you would normally set this up, if you can see that where it says the frequency is set up to your internal policy, right? Aligned with what the regulations are. So if the regulations are you must sample every month, then you would start with you must sample every month for Legionella within the platform. But you're going to have site-specific risks. You might have an old tower that has trouble meeting spec, and you might decide, hey, we have to sample it more than once a month until we get our new tower. Then you select that as your threshold for sampling, and that makes the plan site-specific to the risks identified by the on-site team. But you can standardize what that expectation of behavior right up front. So if you know how you want your cooling towers to be managed, how often you want them to be sampled in your internal SOP, you build that into the system, right? And then you adjust it based on localized risk assessments by the on-site team. And then you create these standard maintenance activities. And this is where we match up a regulation to an SOP that is the building owner's internal expectation of behavior. The regulation is very seldom going to say you need to check the primer on pump 22 once a week, right? The regulation will never say that. The regulation will say you need to sample and let me know if you get a high Legionella result. Well, if the primer pump fails and you're not feeding biocide, you're going to get a high result. So relying only on a sampling frequency as your management strategy is not a proper duty of care. You define the activities that avoid that negative water quality outcome in your plan. And that's why it's critical for the building owner to take on these systems as life and safety systems. Have those systems comply with the local regulation. But you need to set up the policies and procedures that avoid the creation of those risks and get into that detail, right? So verify that the brine, softened water, and C12 pumps are primed. How often do you do it, right? When do you do it? Is it done? Is it not done? Does it need a corrective action? It does. Then the system tells you we need a corrective action. Someone needs to do a work order and manage that risk. And so you want to also support your team be successful. So if you know what you've defined out your tasks, what tasks need to be done when, then you have an integrated, when you have an integrated data management system that oversees your program, you get site-specific notifications to the staff who are responsible for the work, who get a push to their phone that says, here's the activity you need to perform. So you've got these performance checks, these reminders to key staff of the things that they need to do, the timeframes they need to do them in, and then the system lets you know, did they do them? And did you need to do a corrective action? It's this activity, right? It's this routine activity that prevents disease and death. It's not the Legionella sample once a month, right? The Legionella sample once a month tells you you failed. And so you want to organize those activities. And then here's an example for doing grabbing a Legionella culture sample. You know when it was sampled, you know where it was sampled from, you know what building it's associated with, and now you know that you've met the compliance requirement for getting a sample once a month. And then you want to be able to have improved outcome tracking and record keeping, right? You've got lots of moving parts in these systems. And by having an integrated approach, the routine activity just flows into the normal workflow of the folks who are on site or performing the activity. And then when you get an outcome that triggers a corrective action, then you start to say, okay, what do we do next? What are the required actions that get triggered from that result? And in this example, right, it's review the water treatment program, immediately implement remedial procedure number 1. That's defined in the water management plan. That's your internal policy, right? That's your internal duty of care that is defined. This is how we approach remedial action when we get a high Legionella result for a cooling tower. You define that. The regulator does not define that for you. You need to take responsibility for it as a building owner, as an institution. And then you want to track those results over time. And here's an example of that. And you build this all into a kind of a robust integrated data system. And then you start to be able to see what does your risk profile look like across your portfolio, right? So this is many locations across a large portfolio of buildings, and you go, okay, I've got 600 locations that are being tracked. What is the status of my Legionella results? How many were non-detect? How many were positive? How many offline disinfections did we need to perform over a period of time? You see that in a snapshot. So you as a portfolio manager get an idea of like, where do we sit? How well are we managing risk across the portfolio? So those high level metrics are really good for regional compliance folks, right? But you also want to be able to see what does the compliance status look like for an individual building, right? And so here you go. You say, here's an example. Here's an individual building. What does it look like? Is it in compliance? You click on it and you see the profile, right, of what's happening. And then, you know, if we go to the next slide, you get transparency, you get compliance transparency at the building level, right? So you as a compliance manager, you as someone who's the overseer of multiple buildings, right? You're the certified operator for a half dozen buildings in Vancouver. Now you can look at the buildings that you're responsible for and you go, who's in compliance and who's not? Where do I need to make an intervention? Where do I need to apply my professional credentialing, ethical, right, expectations onto a building team that's missing compliance activity, isn't following the duty of care? Where is my educational intervention with on-site staff to help them track the activities that they need to do? And you can intervene. And that intervention, right, the whole point of the intervention is to avoid that elevated Legionella sample result in month 3, right? So you want to, the Legionella result is a validation sample that your plan's working, right? You want to keep your plan on track and avoid those problems as they occur so you don't get those negative outcomes. So with that, it's time for questions. I tend to wax on, so I'm sorry if I went a little bit over. But I guess the takeaway for folks is to understand that we are in a really interesting moment where we're kind of reframing how do we approach the management of risk in building water systems? How do we create ethical and professional standards for the management of those systems so they have the track record of safety that we associate with wastewater plants and drinking water plants? And available for any questions.
All right. Thank you so much, Chris, for that presentation. That was great. I know that we at the EOCP here are working diligently with City of Vancouver and Vancouver Coastal Health. Yeah, it's just, I think it's one of those things that's not widely understood. So getting that awareness out and like sharing your successes, I think is fantastic. We do have a question here from Keltna. It says, why is there such a seeming lack of movement on better management of cooling towers? Moncton, with its second outbreak in 2 years, still has nothing in place.
Yeah, so this is a real struggle, and I put a lot of I poke public health agencies and building agencies pretty hard around this, because this really, in my mind, falls to a lack of vision, and them not taking responsibility for seeing this rapid rise in illness and death and deploying our very routine environmental health and safety practices that we employ in many other areas that have dramatically less public health implications to building water systems and cooling towers in particular. Now in Moncton, I know that they are actively trying to think through, how do we do this? How do we stand it up? So it's tough to make a case for why they haven't, right? And on the building department side, I would argue, why would a buildings department allow for the installation? It would never allow the installation of an elevator that didn't have proper safety controls. Never. It wouldn't. They would never think about it. They wouldn't allow a boiler, right, to be installed without proper safety controls. They do allow cooling towers to be implemented and permitted and installed and approved without proper safety equipment to manage the risk associated with those systems. And so there's a reckoning on both sides of that table. One, on the health department coming up with regulatory strategies to manage routine oversight and management of risk. And the second is with the buildings departments, who are generally very good about requiring high levels of safety in the built environment, allowing these systems to be installed without proper safety controls.
Okay, thank you, Chris, for that. We have time for, I think, a couple more questions here. One from David says, Mr. White mentioned WMP not needed, but would be nice, and only testing will be required. Why would a business owner want to do more than what is currently required?
This is a good question. So the business owner, and this dovetails with the previous, the presentation and leadership presentation before. So the building owner has a responsibility to ensure that the water systems under their control don't cause illness and death, right? And that water management plan is the framework for them to establish their own duty of care, right? That they're doing their due diligence to make sure systems that they manage, they control, aren't the source of illness and death. And the regulator is trying to push you, create some minimum expectations for understanding if you're doing that. You want to marry those two things together because you don't want that negative outcome, right? So that's really where it's a bit of a moral suasion question, right? You want to be the building owner, the institutional entity that's properly managing a risk you know about, right? You know that system can cause illness and death. If you fail to properly manage that system, the negative outcomes are on you, right? You're not unaware. You're aware of it. So you want to take those proactive measures to control it.
Yeah, I would have to agree with that. There's a lot of risk and liability involved, and just understanding those, having those systems in place. So as an owner, you should definitely be on the right page. So thank you for that. There's one more question here from Malcolm. Is there a template available to set up a water management program for your facility?
So we've got some really good guidance documents out there for how to organize and think about a water management plan. And what you need to do is take those guidance documents and then turn them into the water management plan you want for your institution, for your portfolio, for your company, and own what those expectations are, right? So that template is going to give you some broad ideas about how to organize and structure a water management plan. It's not going to tell you what are your maintenance strategies for your recirculating hot water boiler. They're not going to tell you what is your cleaning frequency, your minimum cleaning frequency for a cooling tower. You need to make those decisions yourself. Your company, your firm, your institution needs to define out what are our minimum expectations for how we manage this risk. What is our risk tolerance look like? How do we define success? So that water management template is really kind of a placeholder structure. And then you have to think about, okay, what information are we going to include in our plan? What's our standard operating procedure? That's where that marrying between a local regulation and the standard of care comes together. And it's really important that folks understand that there are a lot of, paint by numbers water management plans that are out there in the marketplace. That's not a water management plan. It's a paint by numbers plan, and it's not going to drive success.
Excellent. Thank you very much, Chris. And thank you for taking the time out to join us today with this presentation. And everybody listening out there, we're going to take a break for lunch, and we'll see everybody back in the leadership stream at 1 o'clock.
12:30.
Oh, 12:30. Sorry, 12:30 for
nice
awards.
To see you and talk to everybody.
Thank you, Chris. Just a reminder to everybody, we're coming back at 12:30 for awards ceremony, so apologies for that.